I'm Tammy Johnson. I'm here to show you the bedpan skill. Today's skill, you will have laid out a bed protector, 3 pairs of gloves, because you're going to need 3 separate pairs of gloves, toilet tissue, a basin, and a washcloth. So I'm going to move this out of the way and get started. Knock on the door. Hi, Miss Jones. I'm Miss Tammy. I'm here to put you on the bedpan. Hold your hands up for hand hygiene and pull the privacy curtain. Then you will go straight into the critical step of this skill of putting the side rails up. This side rail up. If you do not put the side rails up on this skill, you will not pass this test at state. Then you raise the bed to a good comfortable position to you. I shouldn't see you bending over. I shouldn't see you tippy-toeing. And put the side rails down, because there is not any skill that we work over the side rail. The next thing I'm going to do is go ahead and put my gloves on. In your skill book, it does not mention when to get the bedpan. It's like it magically appears. So your instructor will either hand it to you or have it close to you. But I like you to reach for it after you put your gloves on. And it will have a cover on it. Take the cover off, put it to the end of the bed. The bedpan is larger at the top, and that goes towards the top of the head, and smaller at the bottom, and that goes in between. Also, lay it on the bed in the position that you're going to need it. Now I'm going to turn the resident with shoulder and hip, and I like you to get them leaned up against the side rail so that you're not doing the holding the hand and trying to do 2 things at once. You will then take your bed protector and you will lay it out. And then in your skill book, it is worded like you put it on and slide it down. So kind of put it up and then slide it down. You're going to hold it with this hand, hold the hip, lay her down, and then center her on the bedpan, kind of making sure she is on the bedpan. As soon as the bedpan is under the resident, you remove your first set of gloves. Those will go in the trash. You raise your rail. This is a critical step again. If you don't do this step, you will not pass this skill, and you lower the bed, which along with lowering the bed and lowering the rails are a critical step. Put all the side rails down, because you want the bed down and the rails down, because you will be leaving the room while she is using the bedpan. I will also set her into a Fowler's position. These mannequins tend not to set up as far as what they really should for a Fowler's position, but go ahead and set them up as far as you can without the mannequin moving too much on you. So she's sitting in a Fowler's position. I am going to give her the call on, wash my hands, leave the room. I'm going to return when the signal comes back. As soon as I walk into the room, I am going to knock on the door and walk in the room. I'm going to wash my hands. In your skill book, at this point, it's telling you to put your gloves on and then do your rails. I highly suggest, and I have talked to the state instructor, that we do not want you touching rails with gloves on. So go ahead and raise your rails, because it is a critical step. And once we get the rails up and then in position, then we'll put our gloves on. So it's a little bit different than what your book is saying. Let's raise the bed to a good height. Anytime the bed is moving up, or if the bed's moving down, the side rails should be up. Okay, and then lower her back down, because it would be really hard to get her off this bedpan while she was setting up. Lower her down. I'm going to lower the side rail. During the skill, I like to just take the call light and kind of put it under the pillow, because then it's easy to reach. And now I have washed my hands, and I will put my second pair of gloves on. And then this is where it gets a little bit tricky, because you need to hold the bedpan and turn her. So I kind of get the gown ready. I put one hand on the bedpan to secure it, and then just kind of go under here and turn her on her shoulder, lean her up there, gently take the bedpan down to the end of the bed, place your cover on it. You will just take the toilet tissue and provide peri-care, wash from front to back. This is all verbalized. I just kind of sometimes like you to pick things up so the instructor knows and it reminds you. I remove the bed protector, and as in any skill, when the bed protector is removed or a towel is removed, that is when you remove your gloves. So that is removed, and the gloves are removed. Then, using the proper technique of her shoulder and watching your bedpan down here, don't let her kick it off. Lay her down, and then I'm going to raise the rails, which is a critical step again for this skill. Lower the bed, and it's also a critical step. Lower the side rails, both sides, because you're leaving the room, you will not be returning. So you want the side rails down and the bed down. Another critical step, because you are leaving the room, is her call light. At this point, I'm going to put my third pair of gloves on. And you will take the bedpan that is covered, and you will take it to the designated place in the room. I'm just going to go right here for my bathroom. I'm going to remove the bedpan cover. I will, she might have a graduate cover. You can just say that you will save a specimen if necessary. That might not be on there anymore, but for sure say that you will measure the output. You will clean the bedpan and any equipment you use. You will remove your gloves. You will say, wash your hands. Probably put a clean bedpan cover back over, and you will report and record. Thank you.